Students, today I am going to talk about substance abuses, dependence, withdrawal, and its management. I am Dr. Sunil Patil, Professor, Head of the Department of Psychiatry, Sri Siddhartha Institute of Medical Sciences, T. Begur, near Bangalore. So today we are going to discuss about the substances. So what are these substances? Substances are a wide variety of substances will come. The first one is alcohol, second one is cocaine, third one is opioid, fourth one is cannabis, and even methamphetamine. And there are many other things can be included in substances. So I'll be concentrating more on alcohol and its related effects. So we know that alcohol use has been a wide variety of presentations in terms of medical, psychiatric presentations, and also it has got lot of impact on social, family related, and also financial aspects. So to present with, I would like to tell you, like even tobacco has been included in the substances, but I am going to concentrate more on alcohol. So what is abuse and what is dependence? Abuse is nothing but usage of any substances beyond their capacity, or it is causing a lot of problems in their day-to-day activities, but it may not have the real psychological or physical impact on them, leading to medical or coming to any hospital or presenting to any clinic for the problems. But it can create problems in their family or in their any other day-to-day activities. Dependence, on the other aspect, is a proper criteria based problem where a person using alcohol or any substance can have problems in terms of his health, which can be mental health, which can be physical health, or it can be more than that. So we have something called dependence. We can call like signs of abuse also can be psychological or physical, but it will be mild, and there may not be need for direct medical intervention or direct admission related issues. But dependence, yes, definitely it needs more attention. So dependence is characterized by issue where he cannot stop using the substance. Here I have used tobacco, but it can include alcohol also. So they are not able to stop the substances. They are going to depend upon it in so many aspects, in some of both psychological and physical aspects. For example, they can have criteria based diagnosis. We go for craving. They can have craving for alcohol. They can craving for any other substances, but that is the first criteria. Second, they can have withdrawal symptoms where if the body or the mind depends upon, if you start depending upon that substances, the chemicals will have impact on their body and they will start showing the symptoms in terms of tremors, and also withdrawal symptoms in terms of lack of sleep, irritability, and sometimes in severe cases it can lead to seizures also. They can also have loss of control. Loss of control means if they are starting to take little bit of substance, but they will end up in taking lot of alcohol or lot of substances, that is loss of control. They can have also problems like salience, where they will give lot of time and they will spend lot of money on procuring the substances and utilizing it, and this will lead to disruption in their day-to-day activities. They can also have problems in terms of physical health, but they do not stop the alcohol even after knowing that their physical health is getting affected by this substance. So these are some of the criteria which should last for minimum 6 months to 1 year for any person to diagnose them having alcohol dependence syndrome. But one thing we should keep it in mind, that it can cause problems in terms of physical aspects from hair to toe. Multiple complications will come, which will be explaining in the later slides. So why we are worried about substances? Many people will tell that it can be utilized as just a recreational, but once it start affecting your day-to-day activities, it will start affecting your physical health or emotional health, then we should definitely give importance to it. And the reason is it has got biological aspects, social aspects, and also psychological aspect attached to it. So what I am trying to tell you is, biologically it can affect the body, psychologically it can affect your psychological status, and also it will lead to social aspects. So like they can lead to problems in finance, problems in maybe they will meet with accidents by taking alcohol. So drunken driving can be a problem. So all these aspects should be considered in terms of alcohol related issues. So when do you tell addiction? Like as I told, dependence is nothing but addiction. The common terminology is addiction, but the criteria based explanation is dependence of alcohol. Same effects will come, and the issue when we use the word addiction, because it is manipulating or it is modulating the whole behavior in terms of gene environmental interaction. Genes are involved, environment is also involved, and the body will get adapted to depend upon this substance, and they are unable to come out of this substance. So why we are worried about all these things is there are all these aspects are very intriguing, and we have to very carefully assess and evaluate these people to help them. So the common neurological correlates also, what we can tell is there will be structural abnormalities, there can be chemical issues involved, and there can be neurochemical issues and also genetic issues also involved in all these people. So it is not just a behavior problem how people are talking about it or discussing about it. It is biological aspects are also involved. So another aspect where we always tell about these substances or alcohol is they can have this reward pathway which is situated in the brain, where limbic system is a part of it, and the reward pathway works in a way that when the substance goes into the brain, it will release a chemical called dopamine, and the dopamine will tell us to take it again. So this cycle keeps repeating and neuroplastic changes will happen, and the person will have no control over this behavior. That's why many times even educated, uneducated, any person who is there who can analyze also unable to control the control the intake of these substances and having control over it. So this reward pathway is a mechanism where they will go into addiction pattern. And many times when they have done scanning and MRIs, they have found that lot of activity changes have been found, which goes in favor of finding of biological aspects which are important in addiction. So these are some of the examples where you can see a response to spatial working memory task for 20-year-old non-drinking female and 20-year-old alcohol dependent female, where the activity is decreased. So biologically also it's going to affect. It's not just a behavior aspect alone. So chemicals involved are dopamine, GABA, glutamate, serotonin, and also adenosine. As I told, dopamine is very important. And these are the genetic markers which are important, which are associated with the alcohol related issue. So that's why on this basis we can tell that substance dependence or alcohol dependence is a neurobiological disease. So you can also see that various areas which are involved in various chemical changes which are involved in different areas of the brain, which is important in terms of playing a role in forming a circuit reward pathway which is going to keep the person dependent upon these substances. So before coming to withdrawal symptoms, I would like to tell you that we have this criteria based diagnosis. We cannot diagnose anyone who is taking substances. So after the diagnosis, we ask a lot of questions to them, evaluate them, then only we'll come to conclusion. So in that aspect, we can have this some of the withdrawal symptoms in them, where they can have craving for the substance. If they don't take it on that time, at particular time of the day, they'll start having craving, restlessness, agitation, and also tremors. Maybe I have listed some of the things which are important in tobacco also. Tobacco craving also can lead to such symptoms. But alcohol can have more severe problems, like in terms of withdrawal, which can be tremors, which can be lack of sleep or insomnia, and they can go into restlessness, confusion, and also in a severe cases, withdrawal seizures can also happen, and they can go into delirium also. So why we are worried about all these things? Many times they can have lot of issues related to substances. Like we can see that tobacco can cause lung cancer. Like that, alcohol can lead to liver related pathology. Alcohol can cause skin related issues like beriberi. Alcohol can lead to problems like hepatosplenomegaly. It can cause problems like cardiomyopathy in terms of heart. It can lead to problems called parotid swelling. It can lead to problems called neuropathy. It can also lead to brain-related issues like Wernicke's encephalopathy, Korsakoff's encephalopathy, and also something called as alcohol-related cognitive symptoms also, where many people can have irreversible damage, where if they go into Wernicke's Korsakoff encephalopathy, where they will go into confabulation and brain damage will lead, and some people it may be irreversible also. So these things can be kept in mind. And some people can go into metabolic issues like diabetes also, and sometimes they will put on a lot of weight also in their regular if they continue to take regularly. So these are the different patterns where they can go into withdrawal symptoms. Initially, they can go in the initial period, they can have insomnia, tremors, mild anxiety, and diaphoresis and palpitation. But over a period, they can have, as I suggested, withdrawal seizures and delirium. As the time progresses, like 6 hours to 72 hours, this can happen. So alcohol withdrawal seizures we usually see in within 24 to 48 hours. Many times, like as I have seen, many people are not aware that stopping alcohol can lead to withdrawal seizures, which is a very dreaded complication, and they can fall anywhere, they can have any type of complication. Sometimes the death also can happen due to fall and having head injury or fall during the driving vehicle also. So delirium tremens is another aspect where the person can have confusion. It also happens after 72 hours or around 72 hours of stopping the alcohol. Patient will go into a confusion where he will go into insomnia and he will not be aware where he is, what he is doing. And he will sleep more during the daytime. He will start being awake in the night time, and he can hallucinate during that time. And the hallucinations predominantly are visual hallucinations and auditory hallucinations also, and patients will start behaving sometimes very violently during this time, and this is called as delirium tremens when it comes with alcohol related complication, where we have to manage them in an emergency basis. So the symptoms of delirium tremens are like this. So fluctuating consciousness, altered sleep cycle, perceptual abnormalities as I said, and also autonomic hyperactivity. They can go into a lot of increased blood pressure, which has to be managed immediately. And also, if not managed properly, the high mortality rates are there in these cases. So, as I said, a lot of physical complications I have told. There are something called psychological problems also. Like psychological problems are many people feel that substances are just, if you take, it is okay, if you stop, you can stop. But there are chemical changes which can lead to psychiatric conditions, where we have seen that alcohol can induce depression, alcohol can induce alcoholic hallucinations, alcohol can lead to schizophrenia-like state, and sometimes alcohol can lead to mania-like symptoms also. All these are clear-cut syndromal psychiatric diagnoses which are caused by alcohol usage and alcohol dependence. And here the treatment will be stopping alcohol and handling the patient in a different way. Otherwise, these people will have a lot of problems in terms of behavioral issues. So usually, if it is due to alcohol related, it will resolve within 1 or 2 months. If it persists beyond that, then we have to diagnose them independent psychiatric disorder. As I said, cognitive problems can also happen if if alcohol is damaging their brain. We call them as amnestic disorders. As I said, Korsakoff's, Wernicke's encephalopathy. Other presentations are like onset is. So many times we can see how to differentiate between the psychiatric disorders which are caused by alcohol and which can be independent is how the relationship with alcohol or how the relationship with the substance and the onset of symptoms have to be clarified. As I said, the onset is usually correlate with the alcohol usage, and usually once the alcohol is stopped, the symptoms also will disappear. If the symptoms are appearing before taking alcohol, it is not correlating with the usage of alcohol, then we should be careful whether it is an independent issue. This issue comes because we have cases where bipolar disorder mania patient can have usage of alcohol more during the period of mania. So that should not be confused with alcohol related mania or independent mania leading to usage of alcohol. So we call many times that comorbidity of the alcohol usage. So as I said, Wernicke's encephalopathy, where symptoms like acute confusion, it is acute condition where it can have a clinical triad of nystagmus, ataxia, and confusion. So it can be usually it is usually due to thiamine deficiency, which is usually seen in alcohol-related problems. If this is not treated, it can go to late complication, which can lead to amnesia, which is also retrograde and antrograde, and it can also lead to confabulation, where the person will have memory issue and he can start filling the memory gaps by telling some stories where another person is unable to communicate more effectively with them, and this is irreversible damage. So in acute condition, if we treat them with good thiamine supplementation, they can come out of the problems. Otherwise, it can lead to more complications. So what are the assessment? So assessment includes, first is clinical assessment. As the person comes to the OPD, we can assess them in terms of their history, details of the background of family history, background of any other medical history, in the background of usage of any other substances. Many times they may not come with only alcohol related issues. They can combine with many other substances, especially tobacco, sometimes even cannabis. So those histories have to be taken carefully. And also we should ask them about any legal issues, any problems they developed during the usage of alcohol, like drunken driving or fall or any other crime or any other problems related. And during the history taking, we can also ask them about the stress related to usage of alcohol. Many people will come with a reason that they have a lot of stress, worries, or it may be related to family, it may be related to finance, it may be related to work pressure. They will tell all these reasons for their usage of alcohol. Those also think history should be kept in mind for the further treatment aspect. So assessment includes details about alcohol. Like many times if we have to take the proper details about alcohol so that we can have that dependence criteria and proper diagnosis, so that treatment will be easy. And on that basis, we can ask what is the frequency of alcohol use, what is the duration, what is the pattern, what is the type, and also when was the last drink. Last drink is important because we have to assess how the withdrawal symptoms will start and how can we start treatment. Other modalities of assessment is assessment about their motivation, which is in terms of motivational interviewing. We can understand what is their usual motivation. We can analyze what are the stages, in what stage of motivation they are, what are the different modalities we need to help them. So in that aspect, motivation interviewing will help, and we can decide the stages of motivation. So stage of motivations are listed here. We can see that pre-contemplation, contemplation, preparation, action, and maintenance. See, pre-contemplation is they are not yet decided what to do. Contemplation is they are working on how we can stop or what can be done. Determination or preparation or determination is they have decided but they don't know how to go. Action is they know what to do and they have started the action for that. And maintenance is just they are taken step and they are maintaining it. So these are important steps while we are managing in terms of non-pharmacological management. So other aspect we should keep in mind is, as I said, comorbidities. They can have liver pathology, they can have diabetes, they can have hypertension, they can have stroke, they can have neuropathy, they can have any other psychiatric disorder with them. So we have to keep these things in mind to deal with all these aspects. And also we have to assess their cognitive functions, family aspects, who is the head of the family, who is taking the decisions, are the family members are supporting to drink or they are opposing, or is there any fights which are maintaining. All these alcohol issues should be taken. And also family history of any other family member who is dependent and he had complications in the past, that will add on to genetic, strong genetic background, that genetic predisposition is there in this patient. So there are different scales which are there. I think important is CAGE questionnaire, which is very simple and it can be assessed in terms of any student, any person can assess. CAGE is a very basic question where whether he is able to cut down the alcohol or not. If he is able to cut down, not able to cut down, what are the reasons for that? Then what are the reasons he is getting annoyed? Is he getting annoyed because of alcohol related issues? Is he going into guilt feeling that he is drinking and related to complications are happening? And is there any eye-opener drink where as soon as he gets up, he is drinking something, like he is drinking alcohol. Otherwise, he can't start his day. So any 2 to 3 criteria fitting into this, will fall under alcohol abuse or dependence. So this is a simple question. Another detailed questioning will be there in scales like audit, alcohol use disorder identification test. Other scales are clinical institute withdrawal assessment of alcohol. So this scale is helpful in assessing their withdrawal on day 1, day 2, day 3. On the basis of this scale, we can decide the dose of treatment. Like we are going to use benzodiazepines to treat these people. The scale is going to help us. Another scale is severity of alcohol dependence questionnaire. So what are the investigation we do? What we have seen in this paper is many times they come to casualty with multiple reasons, like they may come with tiredness, gastritis, and alcohol related gastritis is very common. And when we see any patient in surgical ward, they will have a background of tobacco and alcohol also. So these people, we have to do all basic investigations and rule out many comorbidities. Like basic investigations like complete blood count, random blood sugar, liver function test, and lipid profile, and also electrolytes, and urine drug screening is an important special investigation we can do in these people. The reason is they are okay to accept that alcohol is a problem, but if they are taking cannabis or any other stimulant or cocaine, they may not come out, and during drug screening is going to help us to screen if they are using other substances also. And also ultrasound abdomen to rule out any other hepatosplenomegaly related phenomena. And many times if they have cognitive issues, MRI can add on to the quality of the treatment also. So this should be kept in mind. And many times if they have cognitive issues, any falls are there, RTA has happened, and they are in confusion, it is always advised to go for CT scan to rule out any bleeding in the brain, which is very, very, very important. So other substances are these, I think I have listed this. So the treatment includes pharmacotherapy, psychotherapy, combination, relapse prevention, and all these treatment aspects will concentrate on total substance cessations. There is no concept called control or reducing. It is always cessation is the goal of the treatment. So goals of the management will be short-term goals and long-term goals. Short-term goal is more of detoxification, where we are going to replace the withdrawal. When withdrawal symptoms are there, we are going to give benzodiazepines, which are long-term, long half-life benzodiazepines like chlordiazepoxide. We are going to give the dose as per the dose of alcohol. Maybe we can give 25 mg morning, 25 mg in the afternoon, and 50 mg in the night. Starting we can give up to 100 to 150, and then slowly we can reduce the dose once patient is improving. And again, scales should be utilized to assess their improvement also, and also sedation should be kept in mind. So that will be detoxification. And also management includes supplementation of thiamine. So thiamine supplementation should be given adequate dose, and it should be started as early as possible, as soon as we see the patient in the initial period. And we should be careful whether we are giving with glucose because it may lead to brain damage if it is not given in a proper manner. But thiamine should be started on the day 1, and it should be continued for few days. And if there are more risk, and there is a risk of Wernicke's-Korsakoff encephalopathy, we can extend it to 7 days or even 15 days, and we can give up to 1500 mg of thiamine per day. Prophylaxis may include 200 to 500 mg per day infusion after test dose. This should be kept in mind. And also to prevent the complications of alcohol use, we have to handle the patients can have intoxicated behavior, which I did not cover in the initial period. That once they come with alcohol intoxication, they can have a lot of disinhibition, which can lead to behavioral problems like irritability, anger, maybe physical abuse or verbal abuse. This should be handled in the immediate situation, which includes crisis intervention. Sometimes we have to make sure that to prevent harms to self, harm to others, we have to also restrain them, and sometimes we have to use tranquilization. I should also point out an important aspect that many people who attempt suicide take alcohol so that they will get energy to attempt suicide. And when you go into the studies, they have shown that a lot of people are taking alcohol before they take poison. So there are a lot of studies behind all these things. And before going into this, I had to bring you a point that there are around 2.5 to 3 crores of people who are into alcohol related problems in the society as per the National Mental Health Survey of India. And many other details will go in terms of any other aspect of cannabis or amphetamine. So these are long-term goals, includes relapse prevention and rehabilitation, social integration also to improve the quality of life. I include family therapy as an important aspect where to include the families, tell them what are the problems and issues related to alcohol and educate them to support the patient to get out of this alcohol and related complication. So this is a slide which will tell you about neuropharmacology, how it acts, but we always give importance to detoxification, which is benzodiazepine. Then we can give anti-craving agents like baclofen, camprosate. These are the preferred drugs, and we give, as I told, thiamine supplementation has to be given, and other medicines which are important is I say topiramate is used as anti-craving, but not much like baclofen. Disulfiram is an agent which is used as deterrent agent. I think it needs a lot of detailing, but it is one of the treatment modality. So pharmacotherapy and potential pharmacotherapies, I think this is related to many other, what I told, same thing, mechanism of action has been explained. So these are anti-craving agents. This is for tobacco. So non-pharmacological agent, as I said, motivational interviewing is done to help to assess the motivation, and on that basis we do motivational enhancement therapy. So the target always will be to stop it, not to reduce it. So this is what I want to tell, and alcohol is one of the important substance where a lot of patients will get presented into casualty or any medical OPDs. To handle them effectively, we should have the medical knowledge, psychiatric aspect knowledge, and also neurochemical basis and the genetic basis. Biopsychosocial aspect should be kept in mind to handle any patient, and knowing about this substance and its related complications, which are short term also, long term also, and also there are irreversible brain damage also. So knowing about this is going to help in the management of patients, and hope this presentation was helpful to all of you. Thank you very much.